morning, I am Dr. Bagchi here. Today we are here at Concern 32 Dental Clinic in Gurgaon. We are located opposite to Medanta Clinic. It's in Sector 39, Gurgaon. We specialize in dental implants and other dental procedures. Today we will be highlighting about the dental implants and the two techniques. One is the conventional technique and one is the immediate loading technique. Now in the conventional technique, we place the implant in the bone and leave it for 3 months for osseointegration. By osseointegration, we mean that the implant gets bonded to the bone. Now this process takes approximately 3 months time. Once the implant is bonded and we confirm it with OPG X-rays, then we advise for the step 2 surgery, which is the abutment placement, the impression and the crown fixation. Now we get a lot of patients who travel far off distance, to get the dental treatments done. We get patients from Australia, UK, USA, the Middle East, from Iraq especially, a lot of patients from Iraq. So for them, it is very inconvenient to fly back and then again come back again to India, spending all the money after 3 months. In that case, we do immediate loading technique of implants. In immediate loading technique, we use an implant system called as GenXT. This is a single piece implant. So in a single piece implant, we do not have to call the patient again for the step 2 surgery. We can rehabilitate the implant, that is, we can fix the crown on the implant in the same time duration. Now here the patient has to avoid having very hard food for the first 3 months. So in the conventional method, where we are giving 3 months time for the implant to heal, in this case we allow the patient to have soft food so that the implant gets 3 months time to heal and osseointegrate with the bone. For the conventional implants, we use different implant systems, one of which is Dentium. Now Dentium is a leading brand of implants which is highly successful. We have been practicing implants in our clinics for over 4 to 5 years now. We have a vast experience. We have a big team of doctors, from prosthodontist to endodontist to oral surgeons. Now in our clinic, apart from implants, we do a lot of other procedures. The most trending one of which is Invisalign. In the past, people used to fix stainless steel brackets and braces to correct the teeth. What we do today is we fix a clear aligners like this. The patient has to wear this for 22 hours a day. We give them the whole box of about approximately 15 to 20 sets, which will help them correct their malocclusion in a given period of time. The advantages are, it is removable, it does not hurt the patient, it's more patient compliant, and it is aesthetic. In today's world, aesthetics means a lot, and function is one part of it, but aesthetics is a very important part which we need to keep in mind when we are treating a dental patient. Be it young or be it old, everybody is conscious about their looks these days. We also have a lot of other procedures like smile designing. Now, if there are some people who have got staining on their teeth, which are internal stains of the tooth, which cannot be corrected with teeth whitening. In such a case, we have a treatment called as veneers. Now on the veneers, now what we do on the tooth, we remove a 0.5 mm layer and we take an impression of the patient. Like say, suppose this is the mouth of the patient. So we just remove a very, very slight layer of the tooth surface. We take an impression and we will fabricate and something called as a veneer, which is just placed on the dental surface like this. Now I can show you a few cases which we have done. Now here is a case of veneers. Now as you can see here, this patient had spacing in between his teeth. Now in order to correct it, we cannot be putting crowns, because crowns mean that you have to reduce all over the tooth surface. So in order for a conservative preparation, we have just reduced 0.5 mm of the layer of the tooth surface and fabricated dental veneers for him. He's very happy. He belongs to Oman and he is a very happy patient. Now we also do full mouth implant treatments. Now those people who are above the age of 50, they lose their teeth, or they lose the teeth because of bad oral habits and various other factors. In this case, we fix approximately 18 dental implants, 10 above and 8 below in a typical case, and then we rehabilitate using zirconia crowns. Now what are zirconia crowns? Zirconia crowns are metal free crowns. They are made by a technique called as CAD/CAM procedure. CAD/CAM procedure, it eliminates all the human errors and makes the ideal crown, which is aesthetic, and it's translucent as well, so the light can pass through it. Now if you can see, the light can pass through it and it is translucent. In this case, when the patient is talking to people, when they are in light, when they are like focused in light or they are in broad daylight, it does not give an artificial appearance. Now there are these cases where the teeth undergo attrition. Attrition means that with the period of time, the teeth, they reduce to half the size, because of which their joint issues start to arise. In such cases, we do a TMJ splint therapy and we rehabilitate the patient using dental crowns. So in a typical case, we have to prepare the tooth surface of all the teeth, upper and lower, and then we fix crowns on all the teeth of the patient. Now this patient, he was a doctor. I would like to show you his case. You can have a look at this. This is what his teeth were before. It's completely attrited. What we did was, we have raised the bite using Hobo's concept. That's an international Japanese concept. Using Hobo's concept, we have raised the bite, and now just look at the height of the bite now. He is completely rehabilitated and he's very happy with his treatment. Now we have other branches. We have one branch in Newdelhi and we have a branch in Gurgaon. We have been working with international patients for a long time now, and we provide all services. Our backhand team provides all logistic facilities and we take good care of our patients. Thank you.